I wanted a postdoc program that allowed me to do that type of interventions and studies that were, not very hard sciences. The type of interventions that are very multifaceted that allows me to travel overseas and stay with the local communities, talk to them and hear from them. And believe it or not, there are quite limited postdoc opportunities. I feel like that really prioritizes these type of programs.
I consider my academic path beginning during my undergraduate degree when I was studying economics, but also pre-medicine. I was really interested in economic theory, but on the pre-medicine side, I was really interested in using medicine to help people live longer and healthier lives.
As soon as I talked with Joe Collins, the director, I knew this is definitely another fresh take on what a postdoc is supposed to be. I've never been pushed before to think about what the impact of my work is. I've always thought about it like when you do a project and then you need to publish a paper, submit for another grant and tick it off on a page or something. But Joe's emphasis on impact was what I think really got me thinking, because it's actually made me think, what's the long-term effect of what I'm doing? It makes me think more about the people that I'm working with and how does the work that I do enable them to live better and longer lives. Working with the Center for Global Health Equity and with the School for the Environment and Sustainability, we're particularly interested in understanding the impacts of climate change on the most vulnerable populations, how to actually measure the impacts of climate change on people's health at the local level.
I'm a nurse scientist by background, and I have always been interested in interventions that are very much community-based and community-oriented, where I get to interact with the people kind of directly, hear from them what the problem is and what the solutions that they think it's suitable. It is enriching to be able to see those community members, and all of them, not just community elites who have higher education, but all having a voice to talk to the politicians directly. I really believe that these interventions are empowering them.
In my work, I'm really interested in looking at health inequities among displaced populations. There are more displaced people than there have ever been in history because of conflicts, both international and internal conflicts, climate change and natural disasters. So I've been working with the Center on vaccination equity among displaced populations. I truly believe if you're doing public health right, it's an interdisciplinary topic. And during my time as an impact scholar, I found many different communities of practice, and one great collaboration is with Dr. Abu Bakr and her group at the Aga Khan University in Nairobi. Dr. Abu Bakr is probably one of the most incredible scientists and people I've ever worked with.
I've done quite a bit of work with Dr. Arun Agrawal. He's an economist at SEAS. I was also lucky enough to work with Dr. Nancy Love from the Department of Civil Engineering. And it's this multidisciplinary approach between engineering, sustainability, and epidemiology that, coupled with the support from the center, that I continue to build on and continue to rely on to do my work.
The relationship that I developed with my colleagues on the ground in Uganda have been tremendous. And I think one unique thing about this program is that it is cohort-based. It really brings so many disciplines, different scholars, and different trainees at different levels together to form these communities of practice. When I was conducting my work as a PhD student, I think I was very much pigeonholed to my dissertation, and it was really difficult for me to take a step back and look at that big picture, thinking about, this is the type of researcher I want to become, this is the type of work that I want to do. But being an impact scholar here at the Center for Global Health Equity really gave me that space and opportunity, gave me the access to the network and the people that I was able to tap onto their knowledge and their experiences. And all of that together, I feel a lot more confident about knowing who I want to be as a researcher and the type of work that I want to do.
It's exposed me to more different points of view. I came from a world that was very engineering focused and epidemiology focused. I've been exposed to how, for example, doctors think about global health, how economists think about global health. And it makes me calibrate my views better about what impact means for different groups of people and how to integrate all that together into a meaningful end product that makes people's lives better.
One of the biggest skills I learned as an impact scholar is something which Dr. Kolas would call the art of collaboration. This isn't something that you can teach in classrooms, it's something which is taught by being done and being part of. It's part of the decolonizing global health movement. It's part of working with your partners in countries in a way which which is different from the norm.
The postdoc is different from a lot of traditional postdoc because you're not necessarily tied to one project, and the center and the mentors that you interact with are invested in you as a scholar.
The center's version of the postdoc is different because of the amount of freedom that we're given to explore our ideas and to build collaborations that is typically not allowed in other postdoctoral type of fellowship.
If we find something which you think is going to be incredibly impactful, or if we find a new collaboration we want to cultivate, it's celebrated that we work on that.
They will go above and beyond in equipping you to become the type of person that you want to become.
The center doesn't measure impact in the traditional academic sense, not in the amount of grant dollars awarded or the number of papers published. The center measures impact in terms of lives saved, lives extended, and the work we did in the communities where we work. It also measures impact in the skills we gained as impact scholars, whether those are hard skills or soft skills.